Good morning and welcome to all medias. As we mentioned in our earlier class, diabetes is more than that of a persistent hyperglycemia because if a person is having a condition of diabetes, it affects the carbohydrate, protein, and fat metabolism basically. That's why diabetes is considered as a metabolic syndrome with a persistent elevation of blood glucose level or persistent hyperglycemia. The main reason behind the diabetes, as you know, there is defect in the insulin in secretion or defect in the action of insulin over cell membrane or defect in both the secretion and action. So, the base pathogenesis of diabetes is there is defective insulin in secretion or in action or in both. And next let us study what are the basic causes of diabetes. From the or other than the genetic cause or the defect in the genetic genes or mutations in various genes, the main reason of diabetes is because of our changes in lifestyle practice. And the specific changes in the lifestyle is with our food style. As you know, all of we people are very busy or very hurry or very worry. That's why we may not have a very regular food habit. And more than that, we consume a high amount of junk foods, high amount of spicy, fatty, oily, acidic or well preserved food or well smoked food or well fried food which contain high amount of polycyclic hydrocarbons or nitrates or nitrosamines or other various preservatives or food additives, etc. Surely the repeated use of such a category of food will damage the insulinic action. Next due to the modern mechanized life, most of we people are dealing with a very sedentary life. That means the physical activity is very poor with we people. So the fast food culture, persistent or a continuous use or abuse of alcohol, then smoking, then various types of drugs, especially the non-steroidal anti-inflammatory drugs, the painkillers, especially the diclofenac sodium citrate or ibuprofen or paracetamol, analgin or aspirins, etc. will have a direct effect over the pancreas, and thereby that may lead to insulinic antagonism, or that will lead to inability of the insulin to act properly. More than that of the fast life or a fast food culture of food or alcohol, you can see that most of we people are under immense stress. To overcome the immense stress, mostly we may abuse with the above mentioned factors. But let us see how the stress that affects, or how the stress that leads to a person to have the diabetes. As you know, in acute stress, the adrenaline or norepinephrine or serotonin or GABA or other amines plays crucial role. But at the same time, when a person is exposed to a continuous stress, that will lead to uncontrolled release of cortisol, and the same cortisol will lead role in inhibiting or resisting the insulinic action. So that is why even in persons without having any family history or without having any abuse of alcohol or drugs or smoking or any other infections, even in such persons also prone to have the diabetes, and most of the cause behind the so-called unknown etiology may be because of their continued, masked, persistent mental stress. So the mental stress directly inhibit not only the insulin, and other various hormones will get inhibited or resisted by the main cortisol. And as we mentioned earlier, the other cause may be due to obesity, and that is why you have to consider the BMI, or you have to consider the obesity as a pre-diabetic manifestations, because when a person becomes obese, automatically he will have a high amount of fatty acids, high amount of fixed acids, and the same lipid molecules or the cholesterol molecule will inhibit the, or that will antagonize the insulinic action. That is why we have to, or that is why the most of the doctors advise the patient to maintain a normal body weight, normal ideal BMI, etc. Only after that the hereditary plays its role. So one of the most important cause of diabetes is because of our uncontrolled lifestyle. unregulated lifestyle, abuse of various types of food, abuse of various types of alcohol or drugs, etc., will strongly damage or strongly inhibit the not only the endocrinal function, along with the endocrinal insufficiency, that will lead to exocrinal anomalies also. And next we have to study about the main role of insulin. As you know, one of the main function of insulin is to help the glucose molecule from our blood. As we know, depending on the glucose demand in our body, due to or via the neurohormonal mechanisms, our liver will convert the stored glycogen into glucose, and the same may get released into the bloodstream. And at the same time, the beta cells of our pancreas that will release the insulin, and here the insulin will act as a key like factor. That means it will unlock the cell membrane, or insulin will help the glucose molecules to get entry in the blood cells. Get entry in the cells. So, one of the main function of the insulin is to initiate the process of glucose uptake from the muscle, and at the same time it stimulates the glucose to change into fat or glycogen. More than that, the insulin will inhibit the conversion of fat or fatty acids or other amino acids into glucose, or to the breakdown of glycogen into the glucose. And likewise, the insulin plays a great role in the normal glycemia of our bloodstream. But at the same time, along with the insulin, there are so many other hormones also plays great important role in the regulation of the normal blood glucose level. I think that can be studied in the next class. And on evaluating the endocrinal function of our pancreas, especially with the insulin, it is better to have an insulin level of fasting insulin level of up to 5 international unit per ml with a healthy level. And if it is in between 5 to 15, it is supposed to have a high value. And if the fasting insulin level is more than 15, it will leads to a high risk. That means automatically the person become very, very hypoglycemic one. So it is very must to keep our insulinic level according to the demand. According to the demand, I mean, as and when the blood glucose level is low, in such condition, the glucagon will be high, and the same glucagon will stimulate our hepatocytes to convert and release the glycogen into the bloodstream, and at the same time the insulin level will be very low. And vice versa, if the blood glucose level is high, automatically the glucagon level will be very low and insulin level will be very high. It is very, very interesting, and it is very curious about to study the hormones like this reactions in our body. Insulin is basically a combination of 31 amino acids. Before the formation of insulin, you know that it is cleavaged from the pancreas into pre-proinsulin and proinsulin with a molecular weight of 9,000 with 31 amino acids. And when the proinsulin is again cleavaged into the very functioning insulin, the molecular weight will reduced into 5,808 with 51 amino acids. So insulin is the physiological, or insulin plays a very great important role in the balance of blood glucose level. And next, about the normal balance of the blood glucose other than the insulin, I think that can be studied in next class. Thank you.